Hello and welcome to Vax Facts FAQs. My name is Amiris Robertson with the National Kidney Foundation of Michigan, and this presentation is geared towards providing you with updates and information about the flu and COVID vaccine and answering any questions that you may have about either of those. On today's agenda, we are going to be talking about self-testing. We're going to be talking about some updates with the flu. We're going to be talking about public transportation mask mandate and the changes with that. And as always, we'll end with our frequently asked questions. So first up, we're going to talk about self-testing for COVID-19. Some key things that you should know about self-testing with COVID-19 or home tests for COVID-19 is that they give rapid results typically within a few minutes, depending on which test you take. Usually there's about a 15-minute processing time for a negative or positive result. Self-tests do not detect antibodies, which would suggest previous infection. So when you test with COVID-19 tests at home, you are getting a snapshot of where you're at right now with the virus. It doesn't give you any indicator of previous infection. And lastly, self-tests along with other practices like vaccination can help protect you and others by reducing the chances of spreading the virus amongst your loved ones and your community. So there is an initiative called the Test to Treat Initiative, which allows you to test and receive treatment all in one location. Self-tests can be used to access the oral antivirals at these test to treat locations. The reason why this is so important is because treatments for COVID-19 need to be started early in order for them to be effective. And so with the new Test to Treat initiative, those who are eligible can get started on their treatment, get tested and started on their treatment in one visit. So next we're going to talk about the public transportation mask mandate. So recently, due to a court order, the CDC order that was previously requiring masks on public transportation is no longer in effect. And this can be really scary for some people because a lot of people have gotten comfortable with the mask and have felt more comfortable with the mask. And there's a couple important things about this new update. One, the CDC continues to recommend that people wear masks in indoor public transportation settings. Masking is beneficial, especially in those poorly ventilated spaces, and a well-fitting mask protects yourself and others, and especially those who are immunocompromised or people that are not eligible to receive a vaccine, like our young children. And also, whether you wear a mask is, even though it's not mandated anymore, it's still up to your choice. So if you feel more comfortable in certain spaces wearing a mask, you should do so. Um, it's a great protection against COVID, but also other viral infections that could be going around, like the flu. So the mask is it's a tool that you should feel comfortable to pull out whenever you need to feel comfortable and to feel like you can participate in certain things like travel and feel safe and secure. So next we're gonna provide a little update on the flu. So currently influenza activity has been increasing, more so in the regions, in the central regions and the south central regions of the country, and increased flu activity for, right now still means that the CDC is recommending the flu vaccination. So there is a typical flu season, but it was suspected that there'd be a late start or a late finish to the flu season this year, because of how we were all inside for last year's flu season. So we were expecting a stronger flu season this year. So while expected, there are still some misconceptions about the flu and how serious it is. And so there is the recommendation that you get the flu vaccine. And if you are eligible or you are at risk for complications with the flu, that you talk to your doctor and your treatment team about flu antivirals, which are available to help treat uh, those with the flu. And it's important that to remind yourselves that the flu is not a cold. It's not a common cold. There are serious complications that can be prevented with the vaccine for the flu. So next we're going to talk about a few frequently asked questions. These are really geared towards the treat, no, test to treat initiative and also the flu. So the first question is, can I get antivirals through my regular healthcare provider? And the answer is yes. This is a new initiative to help start treatment right away and give people the one-stop shop option, but you are still able to go through your primary care physician or other care professionals to receive oral antivirals through a prescription if you are eligible. And in order to be eligible, those those qualifications are different. So again, you really do want to talk to a healthcare professional. The other question is, can I test at home and still participate in the test to treat option? And the answer to that as well is yes. So you can bring in your home test result, that's a positive test result, and still get access to treatment on the spot. So it's still kind of a one-stop shop so that let's say you're not able to get an appointment with your primary care physician, you can try utilizing these centers to access treatments sooner rather than later, because there is that time sensitivity with starting your treatments right away. The next question is, why should people get vaccinated against the flu? Um, so, like I mentioned earlier, the flu is not a cold. It is a very serious disease that can lead to hospitalizations or even death. So also, it's important to get the flu vaccine because the flu virus and therefore the vaccine is different each year. And so the protection that each vaccine is provided, um, that is provided is different each year. So you want to be able to be up to date so that you get the most protection possible from your vaccine. Another common question about the flu vaccine is, can it give you the flu? And with a lot of vaccines, you do feel some symptoms sometimes, like body aches, maybe a fever, or things like that. But that's not the flu. It's your body reacting to the antibodies and the immune response to the vaccine. That's the better way to say it. So those symptoms you feel immediately after are an immune response to the vaccine. It is not a response to actually getting the disease that you're getting vaccinated for. So no, a flu vaccine cannot cause the flu. In the way that the flu vaccine is developed for the needle shot, the flu virus in each vaccine is altered so that it cannot cause infection, whether it's killed or inactivated, or it is just a part or a piece of the virus, like a protein. So it doesn't have the full virus to be effective and cause the flu, or for the nasal spray, it is weakened so that it cannot cause the flu. Also, with the nasal spray, it's cold adapted. So the virus that is weakened also can't survive in other areas besides the nasal pathways. So the virus wouldn't survive in the lungs and other areas of the body to also cause the flu virus. So with that, that is our presentation for today. And we thank you for tuning in to Vax Facts and FAQs. And if you have questions or feedback, we recommend that you email us at reach@nkfm.org or visit www.nkfm.org to get more information on the Kidney Foundation and COVID-19 and the flu. So if you're interested in our next live stream, there is a registration link to where you can be notified of our upcoming events. So thank you and have a great rest of your evening.